now. So, hey, our scrubs have the same color.
Yeah. This hospital has green. Some of them have blue.
Yeah.
The VA has the worst scrubs of all. I think they get them from the same place as the federal prison uniforms or something.
But why do you know why they are using the most boring, most horrible scrubs?
Well, I heard some people that don't steal them. I think
Yes, yes.
Shock Trauma in Baltimore has pink scrubs so that people don't steal them, but then, people
They
still
I would
steal
steal
them.
they still
those.
distill them. Yeah. In
If
some
I
Yeah.
was gonna steal any scrubs, I would steal pink scrubs.
yeah. Well, you see
Yeah.
that there. Now in Texas, you had actually they would give you three scrubs sets, and you have to return one to get a new one. There is a machine to
Yeah.
actually that you do that. I used to break the code of that machine and get more scrubs. So I'm not going to say online how I break, but it's extremely easy to break that the code of that machine. And I tell you offline how to do that
All right.
if you need
Thank
more
you.
scrubs.
Be very
Now,
useful.
well, Amanda, you are the moderator. Why don't you start?
Okay, so I have a list of questions.
First,
We're
start introducing. What is this? Come on.
I have a list of questions, but I'll start by introducing myself. My name is Amanda Armagas. I will moderate this episode of Essence of the Life of a Resident.
Essence of Medicine, Life of a Resident. So you see two generation surgeon here, and I'm Dr. Abbasi. I'm a neurosurgeon. I practice in Minnesota. My residency was long time ago, and I'm not sure if my son Ali remembers that. But Ali, why don't you introduce yourself?
My name is Dr. Abbasi as well. I'm a surgery resident at the University of California, San Francisco. I'm a general surgery resident, and I'm a third-year resident right now. And I do remember when you were a resident.
What do you
Um,
remember?
well, I remember you were wearing scrubs basically 24 hours a day. And I don't think I ever remember you wearing anything other than scrubs. I remember you getting lots of calls at any time of day or night, and you'd also always answer with, "This is Dr. Abbasi, neurosurgery. Did you page me?"
Neurosurgery. This is Dr. Abbasi, neurosurgeon, not neurosurgeon. Because you want to tell them who you are and what service you are. Because when they call you from the ER, you may know now, they call 50 different people at the same time. So they need to know which service is calling back to connect you to the right person. I remember you making fun of me for that.
I
You,
did make fun of you because you always answered the phone with, "This is Dr. Abbasi, neurosurgery. Did you page me?" That's all I ever heard you say when you were on the phone. But I remember you definitely working a lot. You were often at home reviewing imaging findings or things like that, scrolling through CT scans or MRIs, and I mostly saw you during my vacation, so I don't remember you being gone a lot, but I'm sure you were gone a lot.
yeah. So that for people who don't know us, I did my residency in Galveston, Texas. No, started my residency in Dartmouth College in New Hampshire, and you guys went there one time or twice maybe, and
Hmm.
for actually it's very interesting. And September 10th, 2001, you guys were flying back,
That's
and I
right, from
brought you.
Boston.
Yeah, I brought you and your sister. How old were you then?
I was 10 years old, and Layla was 7.
Yeah, I brought you, and at that time they would let me go actually to the
To the
gate.
gate.
Yeah,
Yeah.
I brought you there, and I was looking at the people who were doing the security and so on, and I got so scared because I thought they could do a better job. And next day, I am in the hospital. I'm passing through the. I'm a resident myself. I was an intern then. I'm passing through a door, and everybody's gathered next to the TV, and I'm wondering what is going on. I mean, don't they have anything else to do? And when I brought you there, I was back. I was on call that night, so I was tired. I'm just passing through, and it is all like a dream that that there's everybody's sitting there and things are everybody's excited, sad, and so on. And the day before you flew from the airport, that some of the terrorists were taking off from that airport. As a matter of fact, the main terrorist, I think, took off from the Boston airport.
Yeah, at least one of them took off from Boston. I
Yeah,
don't remember which one.
yeah. But so um, so you came once to New Hampshire, but the rest of the time you were coming to Galveston, to Houston, to Galveston, where I did my residency, and you guys were living in Germany at that time.
That's
So
right.
you saw me in my vacation because those are the only times I took off to have you guys over there. But even still, I still had to work most of the time when you are there. You came for
Yeah,
a long
so
time.
when you were working as a resident, how many hours a week were you working?
Let's start with the easy part. Ali, you go first.
Well, nowadays, luckily, since about 2002, I can't remember the exact year, the work hours have been restricted to 80 hours a week. So, if you think about a normal person working a normal full-time job, we always say it's 40-hour work week, which is 5 days a week, 8 hours a day. So we're doing about twice that. And typically for me, it's 6 days a week, between 10 and 15 hours, depending on what's going on each day. So I get one weekend day off, or alternatively, I get every other weekend off completely.
Every other
Do you have a
weekend.
preference?
I actually, yeah, I think most of us prefer, we call it a golden weekend. What most people call the weekend in medicine, we call a golden weekend. Um, so most of us prefer to have a golden weekend followed by what we call a black weekend, which is a weekend where we work both days, rather than having 6 days on, one day off. Because, if you only have one day off a week, you don't really get into the weekend mood on your one day off. So it's
No,
much more
you're
relaxing.
you're too busy catching up with everything
Exactly.
else.
So I think the 12 and 2 is probably what most people prefer.
Now, again, that what you're talking about is the 80 hours. This is twice already as any regular person works. But when they start bringing it in, first of all, we couldn't believe that that's going to happen. And in many places, actually, officially, they did the 80 hours, and then they had exception to do in neurosurgery and some other fields. They made it 88 hours because they couldn't function with resident working only 80 hours. And then it was just on the paper for a long time until some of the residencies they lost their accreditation, and then people become more serious to really enforce it that they have 80 hours. So do you guys have the 88-hour exception or?
No, I mean, there are some exceptions where, you have to be 80 hours average for each rotation. So if you're going over one week, you have to be below 80 the following week. And you can, in certain circumstances, you can stay longer than the shift limits for, critical patient care or handover activities and things like that. But overall, in this era, at least where I am in residency, the adherence to work hours is pretty strict. Um, they keep a pretty close eye on it, and if you look like you're going to go over, they will actually find a way to get you more time off so that you stay under the 80 hours for the rest of the month. And also, we not just, I mean, you could say that people lie on reporting their work hours, which is possibly true, but we actually fill out a survey every year that goes straight to the ACGME, which is the organization that governs all of medical education. So, while I do have to report my hours to my program every week, I also get to report it straight to the ACGME anonymously.
Mm-hmm.
So there's lots of ways that they keep track of this. And in my experience, we've been pretty good about sticking
Yeah.
to those rules.
But like any other rules, at first people try everything to avoid it until the rule becomes established enough that it becomes harder and harder to avoid it. So some people were saying that it's a joke. It's not never going to work, but you are a proof that once the rule is established, people more and more adhere to that. But I think the most important change came after, I believe, in 2007 or 8, John Hopkins, they lost their accreditation for neurosurgery. John Hopkins, I think everybody knows. Once the organization, like ACGME or whatever organization is, become serious and put a big tag, big price tag on not adhering to the rules, I think people start falling in line. Now, do you want to hear how my residency was?
Yeah.
Well, I would wake up at 3:30. I would be at work around 4:15 or 4:30. I would pre-round until 6 a.m. Then at 6 a.m. we would round with the team. At 7, we would go to the surgery and whatever was needed to be done. Even if I was done at 6 o'clock, which I never was, I had to wait until the surgery was done. They were usually around 8 p.m. to wait for chief resident to come, then we would round. After we would do evening round, I would finish the job and usually around 9 or 10 go back home. Until then I had to wake up next day again at 3 a.m. And for the days I was on call, I would stay right in the hospital and work the whole next day and then go home around between 8 and 9 usually. And I was on call every other day. If somebody was sick, I was on call every other day. The weekend, the golden weekend for us was if I had one day off a weekend. That was for us the golden weekend. And Ali didn't see me working that thing because the week he was there, we are human. I would organize it with others that I would get the lighter duties and so on and so forth. And we calculated easily. We calculated that we were working over 120 hours a week. A whole week is 168.
Wow.
We were working 120 of that. We were working. I remember my first day was the 4th of July in Galveston, and it's a trauma heavy. I started after I pre-rounded, and everybody was angry with me because at 6 o'clock I couldn't round with the rest of the team. I had to report to the ER because I was on ER duty. We started receiving a Vietnamese couple with 3 kids with severe trauma, and before we were even halfway through the managing the first car accident, the second and the third and the fourth came, and it continued. 4th of July is a heavy weekend. Is it in San Francisco heavy as well?
Yeah, it's a lot of fireworks injuries and not so many not so. Yeah, I guess later at night sometimes there's car crashes, people driving drunk.
Yeah.
But yeah, the main thing for 4th of July that I've seen is a lot of blast injuries from the fireworks.
Yeah. So, and I was either pre-call or post-call, and I wasn't going home. How is your call managed these days, Ali?
Nowadays it's very rare that we have in-house call. We typically have moonlighters or locum doctors people who are paid to just work at nighttime, who cover all the night shifts. So because of the 80-hour week, one thing that the 80-hour week I think has made it very difficult to stick to 80 hours a week and get all the operative experience if you're taking night call, which means that if you're staying overnight, every third night like you were, that's just so many hours that it takes away from your operative experience. And, to qualify as a surgeon, you need a certain number of surgeries that you've done. And so
we would get those experience at 2 a.m. No worries about that. We weren't sleeping very often in those nights. Not in Galveston,
Right.
Texas.
That's actually my next question is how many hours a day or a week do you guys think you're sleeping?
I mean, I usually sleep, I would say 6 to 7 hours a night, pretty reliably. It's rare, I think, that I come home so late that I can't get 6 hours of sleep at least. So that's pretty nice.
I think general surgery as well, very close to neurosurgery. You have long hours, but I think the neurosurgery has the worst kind of. I bet if you ask your program or your hospital, probably your neurosurgery has 88-hour rules, not the 80-hour rules. But in most of neurosurgery places, I hear that at least initially they had to apply for that 88-hour, and most of them they got it. Even now, and that attracts people who need just less sleep. I think it's a filter built in. It's not that we Obviously, you cannot keep up. If you need 8 hours sleep to function, it's less likely that you become a neurosurgeon or a general surgeon, because that sort of makes it harder for you to go 6 years or 7 years or 8 years through the whole process. Um, Last night I went to bed at 1:30. I woke up. I was programming part of our database. I woke up at 6:30 and I did a surgery. Thanks God now I can do a 7 hour surgery in 1 hour. Otherwise I would be still in the OR. But I finished that. I had multiple meetings and so on. So I think I probably need about 5.5 hours sleep, but I can function with 4.5 hours. And weekends I usually catch up. And it is not rare, still not rare, and I'm not exaggerating, for me to go bed somewhere between 12 and 2 a.m. and wake up around 6:30 or so. So
Don't people need like a certain amount of sleep to function properly and like make like good decisions, basically be able to think?
very true. Ali, what do you think?
Well, yeah, I mean, certainly, they've done studies that show that sleep deprivation is similar to intoxication in terms of your ability to make decisions and respond to new information.
That's why
So
I'm
I think
always happy.
many surgeons
Oh,
probably think that. Many surgeons probably think that doesn't apply to them, but I think it probably does. It's a very hard thing to study, but I think that every individual is different, and so I think it's important for each person to figure out, what their needs are, so that they can safely take care of patients. I think in the days before the work hour restrictions, there were certainly things that were done that were not safe. They were not safe for the patients who were getting taken care of by sleep-deprived doctors, and they were not safe for the residents themselves who had to drive home, after working 36 hours straight. So I think one of the reasons for why we have work hour restrictions and all these rules about residency is that, in the past, some bad things happened when people were really sleep deprived. And there's a famous case in New York that really started all of this movement towards regulating residency and work hours and things
Yeah,
like that.
yeah. Now, um, you're absolutely right. It's individually dependent, and even individual who need less sleep, it is true that the performance it really goes down. But one good thing about the sleep is, in not everybody, but many people, they can like bank on it. They can catch up over the weekend and then go start. And that's something that I myself do. But residency is beyond just the sleep and so on. I'm sure Amanda has some more questions for us beyond our need for sleep and the hours and so on. So practically, if you are looking for the work-life balance, residency in general surgery and neurosurgery is the wrong place to look for that. Would you agree with that, Ali?
I don't know if that's still true. I think you can certainly have a life outside of residency nowadays. And, many people have lots of personal life things that happen to them or that they choose to do during residency.
Do you have a coffee in your drawer?
There's coffee everywhere now. I mean, there's basically free coffee everywhere in the hospital nowadays. But,
Good.
you know, I think nowadays with the 80-hour work rule and increasing recognition that we want to attract not just one type of person, but we want to attract a diverse group of people for residency, including surgery. I think there's been increasing recognition that to do that, we need to change the culture. In my residency program, I think there were 7 or 8 residents who gave birth to a child in the last year alone.
Wow.
So it's really, I think the times have changed, and I certainly feel like I've been able to have a personal life outside of residency, and be there for things that are important to me.
But you still work 80 hours a week.
Yeah, I think you have to obviously you do have to prioritize. You can't. My life's different from people from my friends who are not in medicine, or even my life is different from friends who are in other medical specialties. I just don't have flexibility. Yeah. I just don't have the flexibility and the control over my life that other people have, and that would be nice to have. So, for example, my vacation has to be set every March or April. We set the vacation for the whole of the academic year. And if something comes up, it's not like I can just, call in on a Monday and say, oh, I'm going to take Friday off because, my brother has a soccer match or something like that. So there is an absolute lack of flexibility. I never know when I'm going to get home every day. I could get home, I could get home at 4, I could get home at 10, and the only way to find out is to, just wait and see what happens. So those things certainly can make life challenging, make it challenging of a personal life. But at the same time, you know, I think the weekends have improved, and more often than not, I am home for dinner, and so I,
What time is dinner for you?
usually I get home somewhere around 7 o'clock. I think it's probably average. So it's
Do you
pretty
ever
nice.
have do you ever have like a fear of missing out, FOMO, with your friends that aren't in medicine?
Oh yeah, absolutely. I mean, it's especially nowadays with, social media, it's very easy to see all the things that everybody else is doing. So there's definitely, weddings or birthdays or baby showers that I miss out on. I don't, get to spend as much time with my
Baby
friends as
shower?
as I would
You
like
miss
to.
baby shower?
Well,
Some people
people,
like hanging out with
life
their
That
friends.
is my
life goes
advantage
on,
of not having friends. So,
And like I said, there's lots of people having children in our residency program. So there's been a lot of baby showers.
yeah.
Um, but anyway, so yeah, you have that, but at the same time, you recognize that doing this job is an immense privilege, and it's immensely gratifying, and it never felt like I was making a great sacrifice to do this job.
Yeah. And
So, how did you guys each prepare to get matched with the residency program that you wanted?
Well, again, I think it's probably, times have changed a lot, but nowadays the residency match, the things that they look at are academics is obviously a big one, research, and then kind of the whole like applicant as a person. And so in terms of academics, the most important things are the scores on your standardized exams called the USMLE Step 1 and 2. Um, they actually just made Step 1 pass fail, so I'll be interested to see how that affects residency selection. Other things are obviously grades
why
that
do
you
you
get in
think it
med
is though?
school.
Why do you think they change it from a score to pass fail?
I think people recognize that it's probably a poor proxy of getting a good score in the standardized exam is probably a poor proxy of if you're going to be a good doctor or not.
Agree.
And it
And
may
do you want to say
elicit.
for most of people they may not know what step one is? What is
Yeah,
the
step
step?
one is basically an exam that tests the basic science knowledge and basic clinical knowledge needed in
Not
medicine.
clinical,
So,
basic science, right?
but most of step one is heavily tilted towards the basic science. So they would ask you about, you know, what the effect of a certain drug on a certain molecule is, or what this certain cell in the immune system might might do in a certain context.
Yeah.
So it is very science heavy, and it's not necessarily things that are useful for everyday clinical practice. And so for generations, med students would spend a lot of time sweating over this exam, and spend months and months preparing for it. And the score, in the last, at least until recently, was one of the most important um, factors in residency match. I think it's probably a good idea to make this exam pass fail, because as we mentioned, it's not really relevant for clinical practice.
What was your score?
Yeah, I don't think that's something that we should we should get into here. Um, the the other trend that's been happening with medical education is even the medical school has now become pass fail. A lot of the preclinical curriculum
Yeah.
has become pass fail, and so in my medical school, the clinical rotations we still had grades, but everything before the clinical time
Okay.
was actually pass fail as well.
Since we talked about that, I know your score was very high because you matched to one of the most prestigious residency program in the entire United States. UCSF is, if not the among top 5, probably is among top 8 residency program in the entire United States.
Yeah, I feel very, very lucky to be here.
Yeah.
That's for sure. And they do attract some really amazing people, and I think one of the things that they do a good job of here is to look beyond just the academics. They do look for people who, first of all, have an interest outside of clinical medicine. So that's usually research or advocacy, or device development or things like that. And then they also look for people who I think have a personality that fits with our culture of being being kind to each other, having some degree of work-life balance, having interests outside of the hospital, and just striving to take the best care of our patients while also taking care of ourselves.
You're making me
And
jealous now.
I think certainly have it a lot easier than you did at UTMB. But you had the added challenge of matching as a foreign medical graduate, which is a whole different story. And I think I was very lucky to come here as a graduate of a great U.S. medical school, and where people that I worked with in medical school knew a lot of the people at UCSF and could make a phone call and reach out on my behalf. That certainly played a huge role. So I'm very grateful to those people back at U Chicago who helped me get where I am today. But it must have been a lot harder for you as a foreign graduate.
Well, I have been told when I start matching that it is unheard of a foreign graduate directly matching. Most of the foreigners there, I have been told that they go if somebody like falls out, like 30% or more than 30% of the neurosurgery resident, they don't finish. And when a vacancy is available, they attract some of the foreign graduates. They come sideways. But I've been told that it's rare that somebody with foreign medical graduate match. But I think it's possible, but it was definitely much more difficult because they are a little bit of an unknown to the residency program. Is it the right person? Is it the right education? Is it the right background? Is it the right attitude? Whereas, like your people probably could just trust that if somebody from the University of Chicago give you a reference, that reference truly was more accurate than some reference from Germany who nobody had any idea who that is.
Yeah, I think there certainly is that element of just people that knowing people in those programs and having those personal connections. But there's also, I think, a certain element of I don't want to call it snobbery, but maybe just the U.S. exceptionalism that they don't view foreign medical graduates as equivalent to U.S. graduates. I mean, I've worked with some amazing people who went to med school in other countries, so I think there's a certain to a certain degree that's probably unjustified, that advantage that you have as a U.S. graduate.
Yeah.
That brings us up an interesting conversation I had with Dr. Abbasi earlier in the week about different medical schools across the country. Can you touch on that?
Across the globe or across the country?
The globe.
Yeah.
Can you touch on that?
Ali didn't go to med school outside of the United States. I did do my med school in Heidelberg, Germany, which is by many regards one of the better universities in Germany. I can tell that overall, I think American medical education system is superior. And I went to as well med school in Iran, so in three continents, in three countries, I can tell based on my own experience that American medical system education is superior to all the other things that I have seen. It's very much based individualistic on how to give actual knowledge and actual clinical skill to both resident and med students. And that doesn't mean that individually that one person is less educated than another. But I can, like in US, in the residency, we have a residency program. It's truly a program. It is each year it advances, and clinical skills that has to be passed on are fixed, and somebody looks over them. Where I can tell you, at least in my time in Germany, the residency was you could be 5 years in one department and never advance. You could become officially a neurosurgeon without having truly those knowledge and the skills passed on to you. So, but this is my own experience. Now, in that regard, even though Ali, I agree with you, there's some snubbiness in the American medical system. and part of that is, I think, is justified because we have to be careful who we let open up somebody's skull to take the tumor out, and that is not given. It's not the same thing that if you call somebody neurosurgeon or general surgeon here who has gone through a residency program and where, as you know, 10 different entities are looking over that you get the knowledge you need to perform what you need. This is not necessarily the same, not even in Europe. Um, in Europe, you may be one of your favorite resident of the chair person, and you get all the knowledge which happened, and or you could be somebody who's there just on the sideline for the 10 years, whereas we are egalitarian here. We truly make sure everybody get the exposure. The rest is truly up to you to, in that time, invest your time and energy to get the exposure you need. So that snobbiness, it is true, but partially justified.
Yeah, I don't know what it's like nowadays in Europe, but I do get the sense from talking to people who are in residency now in Europe that there's probably an earlier transfer of autonomy to the trainees in the United States. And it does seem like the residency programs are more they're more highly regulated and more the experience is kind of more fixed for where everybody does get the same experience than is the case in Europe. I don't know what surgery is like there now, but
Yeah, but I felt it in myself. I was a resident in Germany from 1996. You were there's a picture of you being this big when I finished my med school in 1996. You were 5 years old, right?
yeah.
And I was 6 years, 5 years there resident, or maybe less, before I came to United States. And you can get a fantastic exposure, or you can get no exposure to what you're supposed to do afterward. But it wasn't anybody who would go and make sure that you will get that exposure. Whereas in the United States, there's a program. There is an entity that makes sure you get the exposure. The rest is to your skills, to your investment, and so on. And I think that's what's make it different. Yeah, but how far are we into this? I think it has been at half an hour. Let's maybe give it a few more questions, Amanda. What question do you have for us?
Yeah, so I have some questions that were submitted.
Mm-hmm.
What do you residency right now?
I'm sorry.
Well, I really enjoy that every month there's a new challenge. Typically I'm on a rotation for about a month at a time, and so every month I get to work in a new area with new people and meet patients who suffer from different types of conditions. And every month I get to learn to do new surgeries, and every year I get more responsibility. So it really is a never-ending challenge. It can sometimes feel like you're drinking from a fire hose, and it can be stressful and can be hard, and there can be sometimes bad things happen to your patients. And that can be really tough. But overall, I think it's an immense. It's just wonderful to be constantly stimulated and challenged like that, and to have the support to be able to learn and grow during that time is really wonderful.
I want to have a question for you. Always, I want to ask you when something bad happens, and in what we do, something bad happens every day. You cannot do what we are doing and not bad outcome to happen. How do you cope with that, Ali?
Well, I think it goes back to the work-life balance that we were talking about earlier. I think it's really important to be able to leave the hospital behind at the hospital doors. And when you get home, ideally you have things in your life that can take your mind off the things that happen in the hospital. So whether that's exercise or loved ones, family members, friends, partners, hobbies, all those things I found have helped me kind of leave the hospital behind. And then the other thing that is really helpful is to just debrief with my colleagues. And I love getting a drink with my colleagues and talking to them about all the things that happen inside the hospital, because really very few people can understand what we're going through. And the only people that I feel like I can really debrief with are the people who are going through the same thing.
I think we are human beings, and human beings will make mistakes. That is inevitable. I think how I have been learning to cope with that is every mistake I have made had made me an expert on that area. Like, and never let a good mistake go to waste. Learn the best you can be. They say experience come from good judgment. No, a good judgment come from experience. Experience come from bad judgment. Meaning that when you make a mistake, um, we go, and this is pounded into us. Ali will do the same thing that was he was referring to the briefing. It is pounded into us. We go analyze why something bad happened. We see what we could do different or better, and we incorporate that into our every mistake we make us a better surgeon. And if we don't use that mistakes to make us a better surgeon, we are in the wrong business. We are in the wrong profession. We have to, more than any other job, we learn from our mistakes in our career. So Amanda, what else?
This is my last question I have for you guys. Do you ever regret your decision to join the field that you're in?
Other than every day, no, I'm just kidding. You know, there's always moments where it's been a long day, you're tired, something else is coming your way that you didn't expect or want, and you feel maybe some frustration, or even you may even feel burnt out, or like you just can't handle anything else. But those moments, I think, are with a good support system around you, you can make it through those moments, and then when you reflect on them, you realize that those are the moments that make you grow the most. And so I don't think that I have any regrets. I think that I personally can't see myself doing anything else with my life. I think doing surgery is such an amazing craft, and being able to do it for a living. I always say that I would do surgery for free. It's all the other stuff that you have to pay me for, like the writing the notes and doing all the paperwork. But honestly, doing surgery, I would do that for free. And so I just can't imagine anything else that
I like that. I would do the surgery for free. You have to pay me for the rest. Yeah, I love that actually. That's a good
Yeah.
one. Did you come up with it, or?
I came up with it myself.
Good, excellent. Now, I can really second that. Uh, there are days, now, when you go to the hospital, you're in a part of a big system. You're not just taking care of the patient. That part I could do 24/7. But then you have to take care of administration. You have to take care of a system that wants you to be a secretary, wants you to be an administrator, wants you to and they just put loads and loads of things that have nothing to do with the patient care, and all of that is disguised as it's for patient safety, it's for patient care, and when you look into that, most of that is nonsense. And in those days, I regret every time they put another load of bullshit, nonsense on my shoulder. I regret that. I have a folder here, and in each place I have a folder. These are patient cards to me, and I have a
Thank you cards.
Of that when they take my hand, when 5 surgeons have told them they cannot have, nobody can help them, and I do a 45-minute surgery, they can walk, they can do things that could not do before. That genuine thank they give me truly compensate for 10 administrators that make my life to living hell. And make no mistake, they every day they make my life to living hell, because they confront me with things that I'm not trained to do, like push this button or that button now, or just do meaningless things to satisfy. Most of the time, I comply with the rules of people who have not spent the full hour in a year in a war. Okay, and that that is exhausting. As Ali said, I could do 24/7 OR and take care of the patient, and because we see the result what we are doing, trying to keep the whole surrounding thing happy and satisfied. That is what that truly exhausting to me. Even after so many years, even after this many years, I just have to shake my head and just take a deep breath, and then the next card comes and compensate for that.
Okay, that was a great answer from both of you guys.
Oh, well, thank you, Amanda. Thank you, Ali,
Thank you.
for joining us. I
Been a
hope
pleasure.
this gives a lot of people good understanding that it is truly worth it through this. Now more than ever, you don't have to go through my residency. You will go through Adley's residency if you decide to do this.
I don't know if when you were younger, did your parents ever tell you, like, when I was your age, I had to walk to school uphill both ways through the snow? That's kind of what you reminded me of when you were talking about your experience versus Ali's experience.
Okay, well, life is getting better for everybody. If
Yeah.
you're in doubt, there is a philosopher linguist. I just forgot his name. I always listen to him. Now that I'm looking for him, I forgot his name, but we will put it in the that
Put in
he
the
says,
caption.
based on data, that humanity has never lived a better life than now. So I'm a total optimist about the future and what we are doing. It's exciting.
I think you're talking about Steven Pinker.
Pinker, exactly. I'm talking about Steven Pinker. That based on data, we have never lived in a better time than now.
I agree.
How do you know Pinker, Ali?
Well, he's super famous. I don't know.
Okay. Well, thank you everybody for joining us, and thank you Amanda, thank you Ali.
Thank you.
Bye.
Bye-bye.
Thanks, guys.